Hi, I'm Patrick Bartmus, and this is a series about being a caregiver for a parent. As I watched my mother struggling against the effects of Alzheimer's disease, I feel a pattern emerging in my responses. I have a strong desire to help her. Obviously, she's my mother. When I see her suffering, I want to alleviate it. And it's difficult enough to witness someone bearing physical pain that I can't take away. Not only is there no remedy for dementia, there's really no reliable way to detect whether our attempts to alleviate the symptoms have any effect. When the struggle is so deeply personal, so spiritual and emotional, there's really nothing another person can do to ease that passage. Health and wellness professionals offer drugs and herbal concoctions and behavioral interventions that only seem to affect my mom during the early stages of this disease. And I use the terms stages and disease because that's how we frame it when dealing with doctors. In truth, this is a life change that causes incontrollable suffering. And this is the aspect that I struggle with as a caregiver. I see her loss of control, I feel my loss of control, and none of the strategies I've developed over the years, as a human, much less as a caregiver, provide any relief for the anxiety and sadness I feel. Meditation helps me personally a little bit, but I can't sit with my eyes closed all day. I have to get out and work. And perhaps my practice creates a little bit of peace that I can share with my mom when I visit her, but that's nowhere near enough. She lives with this condition all day, and there's nothing I can actually do physically to help her. It creates a sense of helplessness and despair that feeds on itself, because when I detect it and address it, I've discovered that I have no method to help myself out of it. Again, breathing exercises provide some relief, but afterward, the hard fact remains that I have no resources to actually make a change in my mother's suffering. So, what do I do? There are a few actions that afford me a momentary feeling of accomplishment. Perhaps they help my mom too in the moment. I hold her hands, I rub her shoulders, and sometimes when it feels like it isn't too invasive, I massage the muscles of her feet and calves. She has pretty bad arthritis down there. I talk to her in a normal tone of voice and tell her about everyday things. And I make sure I say the words, "thank you," at least once per visit. Everyone knows sincere gratitude when they hear it. I've hired therapists, like yoga teachers and physical therapists, to work with her one-on-one. And even though it's expensive, Medicare doesn't pay for that, and they have to change their paradigm from getting better to feeling good in the moment, the personal attention does seem to help her and make her feel good. These things are not curing her, and they only seem to help for a few minutes, but it's what I can do. I hope this helps you as you consider caring for a loved one or as you plan for your own future care. Thank you for watching.